How many air exchanges per hour should rooms have for allogenic hematopoietic stem cell transplantation recipients? A. 2. B. 4. C. 12. D. 15. The best technique to use if hair removal is necessary before surgery is to A. Remove hair with clippers the night before the surgery. B. Shave hair with razor immediately before incision. C. Remove hair with clippers immediately before incision. D. Remove hair with a depilatory the night before surgery. The most likely cause of mastitis in nursing mothers is A. Maternal flora invading nipple. B. Infant colonized with Staphylococcus aureus. C. Contaminated breast pump. D. Inadequate cleansing of breast. Which kind of vascular access device carries the lowest risk of infection for individuals who need hemodialysis? A. Arteriovenous fistula. B. Arteriovenous graft. C. Right internal jugular catheter. D. Subclavian catheter. The most efficient strategy for preventing hospital-acquired illnesses is A. Hand washing. B. Screening patients. C. Immunizing staff members. D. Isolating infected patient. The best way to explain an evaluation process is to utilize the following when serving as the chair of a quality improvement committee that is analyzing processes and procedures to identify where problems exist. A. Flow chart. B. Narrative explanation. C. Illustration. D. Video. How long are immunoglobulin M antibodies against hepatitis a virus detectable in the blood after exposure to HIV? A. 7 days. B. 3 weeks. C. 1 to 10 weeks. D. 48 hours. Most facilities will need the following when contemplating reprocessing medical devices. A. Increased training for staff regarding reprocessing procedure. B. Hiring of additional personnel. C. Improved sterilization, processing equipment. D. A contract with third-party reprocessing organization. The IP's main area of attention should be A. Infection prevention. B. Reduced liability. C. Infection control. D. Cost savings. The first step in reviewing products with the Product Assessment Committee is to A. Identify the need for the product. B. Compare the product with similar products. C. Outline costs. D. Discuss the potential savings. The term that denotes the typical occurrence of a particular disease within a particular geographic area over a particular time period is A. Epizootic. B. Endemic. C. Epidemic. D. Pandemic. The just-in-time inventory concept's main goal is to A. Maintain better control of inventory. B. Prevent waste of medical supplies. C. Ensure adequate stock of medical supplies. D. Minimize cost of inventory. The ideal method for instructing a group of nurses, both experienced and inexperienced, is to use the same approach with all participants. B. Remind the experienced nurses to be patient with the novice nurses. C. Encourage experienced nurses to share experiences. D. Separate the nurses into two separate groups. Which of the following indicators is most likely to take the most time for surveillance data collection? A. C. A. U. T. I. B. C. D. I. C. V. R. S. A. D. CLABSI. Which of the following is an example of passive case finding in a suspected outbreak? A. Notify healthcare providers to be alert for additional cases. B. Examine county surveillance data. C. Ask the laboratory to identify further cases. D. Use a diagnostic test to screen at-risk individuals. How long is a patient contagious after being exposed to the West Nile virus? A. As long as symptoms persist. B. 1 to 2 days before symptoms occur. C. 7 to 14 days after symptoms occur. D. 6 to 7 days before symptoms occur. Ambulatory care facilities must have A. All staff in infection control and prevention. B. 1 full-time equivalent IP staff person. C. 1 person available and trained in infection prevention. D. Affiliation with a facility with a IP staff person. The ideal time to obtain a sample of sputum for testing acid-fast bacillus is A. Afternoon. B. Bedtime. C. Early morning. D. Midday. The best way for a small, independent organization to save money when buying medical supplies and equipment is to A. Emphasize reduction in waste. B. Conduct improved inventory control. C. Conduct price-oriented product evaluations. D. Join group purchasing organization. Which of the following tests for Clostridium difficile diagnosis has the best sensitivity and specificity? A. Toxigenic culture. Nucleic acid amplification, including PCR. Toxin enzyme immunoassay. Glutamate dehydrogenase. CBIC test. The CBIC test is a computer-based examination administered at 140 locations throughout the United States. It takes 3 hours to complete and consists of 150 multiple-choice questions. The CBIC exam measures the competency of individuals with direct programmatic responsibility for infection prevention in healthcare settings. Applicants will need to meet certain specific educational and practice requirements. One of the best ways to prepare is to take practice tests. This will help you to gain confidence that you are prepared, and it will also allow you to gauge your performance. Another benefit of taking these practice tests is that they will help you to understand which questions are difficult for you and which ones are easy. This will make it easier for you to know what areas you need to focus on during your actual CBIC exam.